Hi, I'm Dr. Mukesh Gupta from Lenest Malad. Miscarriage or early spontaneous abortion. It's a situation which is not so happy and it leads to a lot of heartburn and trouble in the family. Normally, when we are expecting the pregnancy to go so good, and suddenly when you're coming across the news and when the doctor tells you that it may not be a good pregnancy and it is not going to go further, that is the time when we are really in a lot of stress. Well, before even we go ahead and decide and discuss what are the treatment options, why does it happen, and how we can prevent it the next time. These are the three things that we're going to discuss today. We need to first understand that this is a situation where the lady needs a little extra support, not just from her family, but also from the healthcare setup. When the abortion happens and the message is informed to you, we need to first understand what is the process of spontaneous miscarriage. Initially, the uterus is closed with the pregnancy inside, and if the pregnancy is not good, the process may start. There is a little bleeding, and then gradually the os may open, and then the pregnancy may come out, and it is expelled and thrown out by contraction by the body. There might be a little pain at this point, and then the pain will stop once the products have been expelled out, and then there'll be bleeding for a few days, and it will stop. This is a normal, natural course of abortion. Of 100 women who get pregnant, about 10 to 15 of them normally land up with this early abortion. And of these 100 women who land up with early abortion, almost 80% or 75% of them will land up with natural spontaneous expulsion. But this process of natural expulsion may take time. It may be just a few days to even a few weeks, sometimes even 3 to 4 weeks. And that is the reason why we need to think and decide on the treatment options. So when you're faced with this situation, you have three choices. Choice one, that you may just wait out and let the natural expulsion happen. Choice two, you can undergo a medical treatment whereby some medications can be given to you either orally or vaginally, and that can lead to contraction and expulsion of the fetus or the products of conception. And choice three, you may undergo a small tiny aspiration procedure which may be called as a dilatation and evacuation or a dilatation and curettage. Or in other words, it's actually an aspiration of the products of conception under controlled atmosphere that is in the hospital. So these are the three options that you have. I've already discussed about the wait and watch policy that is expected. The second option is about taking some medication. The doctor may advise you some medications which you can take orally or insert vaginally, following which there will be cramp and pain and bleeding, and the products of conception will be expelled out of the uterus. Advantages that you don't require an hospital admission, advantages that it doesn't require any surgical intervention, advantages you do not require to undergo any anesthesia, advantages that it can happen in the surrounding and the confinement of your house or your relatives or your friends or your support system. The disadvantages that out of the 100 people who would undergo this, almost like if the process is started, most of them will get aborted. But if it is an embryonic pregnancy or an early missed abortion, then there is a possibility that around 10 to 20% of them may still land up undergoing a check curettage. That means there is an incomplete expulsion and they may still require a dilatation and curettage. The third option is what is commonly called as a DNC, that is dilatation and curettage, or aspiration. It can be done in many countries in OPD basis, and in some places they normally admit you in the hospital and take you in the operation theatre. Now, when we talk about this procedure, what exactly happens there? When you go to the hospital, they'll give you some medications and they'll give you an intracath IV line, and then they will give you some injection or sedation from that line so that you'll sleep comfortably. And then the doctor may aspirate the contents and clear the uterine cavity. It is almost like 98-99% sure that nothing is left behind, and it is the most effective way. It just takes a few hours of admission. Actually, the procedure takes hardly a few minutes, following which you may be staying in the hospital for a few hours and you will be out of the clinic for a few hours and you can go home. Probably by evening or by the same day evening, within a few hours, you'll be back to your routine activity. So, advantage that it is a short process, advantage that it will not be very painful and it is in a controlled environment because it will be under anesthesia. Advantage that you don't have to wait for long. If you wait for the expectant management or a medical management, it may take a few days. But here, the same moment you're free and you do not have to carry that stress of holding on to the situation knowing that nothing fruitful is going to come out of it. And it is a tremendous psychological stress at that time. So these are the options that are available. Now the million-dollar question that people ask, doctor, why did this happen? Could we have prevented it? What precautions should I take so that it doesn't happen again? Well, if you ask me, the first few weeks of loss of pregnancy or abortion or miscarriage, most often than not, it is because of some or the other genetic abnormality or abnormality in the fetus or abnormality in the sperm or the egg, which can lead to abnormal fetus. Most often it is that reason. It may be because of some hormonal reason sometimes, or immunological reason sometimes, or sometimes it is just not known, what we call as idiopathic or unexplained abortion. If it happens for 1 or 2 times, the investigations may not be very much in detail needed. But if it is happening again and again, 3 or more times, then we need a thorough checkup. This is the time when we call it a recurrent pregnancy loss. And that is the time when we need to really work you out and find out what exactly is the cause at length. But right at the first time also, we can look at some of the hormonal things like the thyroid disorder or vitamin deficiencies or anatomical issues which can be checked on a sonography, and all those things can help us if there's any pathology in the uterus or any, say for example, fibroids or abnormal congenitally different uterus, and etc. etc. This can be easily done by a doctor. So this answers your question, why did this happen? Second, could this be prevented? I always say that if Mother Nature is taking a call, most often than not, it is in your best interest. So there might be some issue or problem because of which the pregnancy is not contained. Remember the basic rule of evolution, survival of the fittest. So if the pregnancy is good, most often than not, it will continue. But sometimes in some unfortunate situation, there might be some reasons which can lead to abortion, like for example, infection at that time. But that can be tackled, and remember, if it happens this time, it is not going to cause abortion again, because now your body has developed immunity to it, that infection. So don't be scared that if this time you have landed up with an infection and abortion, so next time again you land up with that. It's not necessary. Last but not the least, can we do something to prevent it next time? Well, this is what your doctor will explain you best as per your individual findings and as per your individual investigations. Believe in your doctor, sit with them and talk with them. Now I would end this whole discussion with only one take-home message. Remember, the best case scenario, if your pregnancy is good, it is going to continue ahead. The worst case scenario, if it is aborted, most often than not, Mother Nature has chosen this because you have something better in store than what you have at this moment of time. Sometimes it pays to have patience, and I understand that it is extremely painful and extremely stressful and extremely disheartening to land up with the situation. But there's always going to be another time. Wish you all the very best. Thank you.